Well, drug overdose deaths have doubled in the United States during the pandemic. The CDC is reporting that deaths increased from an average of 50,000 a year before the pandemic to 100,000 overdose-related deaths since March of 2020. In response this week, Assisted Recovery Centers of America opens a new center, a welcome center they call it, at Olive and 14th in downtown St. Louis. And Sunil Menzies is with ARCA and joins us to discuss. Good morning, Sunil.
Good morning, John. How are you?
I'm doing okay. Thanks for joining us. First off, how does the pandemic cause an increase in substance abuse?
So, to what you said, we already had a pandemic, and we had an opioid epidemic, and then you throw a pandemic like the COVID-19 pandemic on top of what was currently going on in terms of the mental health crisis our country was facing, and it has exacerbated not only opioid use, but other substance use disorders such as alcohol and whatnot. At large, mental health has been affected from things such as isolation, loss of work, forced time away from family, loss of loved ones. So the overall stress that the pandemic has brought to individuals and families has just exacerbated the problem.
And in Missouri, a 52% increase in overdoses with African Americans. And you see this need in downtown St. Louis. We're looking at some of the rooms you have. Let's say I'm having an overdose. I go to your location there on Olive. What happens next?
Yeah, so as a result of the severe and steep increase in those asking and seeking help during the last 12 months, ARCA made a very conscious decision, really out of a moral obligation. We felt that as an outpatient program that was really rooted in virtual care, we were able to continue serving our patients. And so the new space will allow for prompt care, minimal barriers, and hopefully an attractive environment. One thing my father, Percy Menzies, and our medical director, Dr. Fred Rotnick, have always said, we need to make treatment attractive. So patients and loved ones are able to walk in. It's a comfortable space. We will initiate treatment, stabilization with medications to allow the individual to feel healthy, hopefully by the time they leave. And then, as we said, we didn't call it an admission center or a stabilization center. We were intentional about calling it a walk-in center or a welcome center. We want it to really resonate with patients that when they come, it's a comfortable space, it's a warm space, they'll be given a hot meal. They can spend 3, 4, 5 hours with us. Many of the patients we treat as a result of the severity of the opioid crisis are truly indigent. They really are homeless. And at this point, those wraparound services in conjunction with the acute stabilization is so crucial for the folks we serve.
All right. Well, this is at 1403 Olive, and that is at Olive and 14th. And is it Suite 100?
Yes, and so the whole first floor, you can walk into the first floor. We have multiple clinics and the pharmacy. We really built it out. Very proud of what we've been able to do to serve our community, especially as we make a very pointed and intentional effort to go after the African American communities and really begin to improve access to care and serve them. As you said, while we saw an increase in overdoses across the board, the African American communities, our refugee communities were disproportionately affected once again.
Sunil Menzies, thanks for joining us from ARCA, Assisted Recovery Centers of America. They're located all over the world, started right here in St. Louis. We appreciate it.
John, thanks so much for your support.